Good morning, everyone. My name's Angus McFarland from the Australian Services Union. Thank you for joining us today for this webinar. We're waiting for a few people to join us. We did have quite a few registrations today. So we just, I'll give it a minute or two for people to join us today. It is just 11 o'clock and then we will kick off and start the information session. I can see familiar names there. Please do say hello and introduce yourself in the chat box and let us know where you're joining us from today. And as I said, we'll kick off soon. There will be lots of opportunities to take questions as well. So there's a Q&A box there for that purpose if you've got questions today. Although we will also go through a lot of frequently asked questions that members have already put to us in the last week. So I'm sure that hopefully all of the questions you have will be answered if I can answer them, and if I can't, we'll try to find the answer for you and get back to you. Okey-doke. I can see Joe Marks, Tom, Hayley, Elias, Carol. Okay. Well, what we'll do, I'll just make sure that my phone is on silent so we're not disturbed, is I might kick off now. And so, hi everyone, my name is Angus McFarland. I'm the Assistant Secretary of the Australian Services Union. I'd like to begin by acknowledging the traditional owners of the land on which we are meeting today and pay respects to elders past and present. I'm on Gadigal land in Redfern, and I know that you're joining us from diverse lands across New South Wales and also the ACT. Today we are recording our meeting for members who cannot make it, and also we will be it's in webinar format, I guess, to protect people's privacy for that reason, in case you are asking questions that might reveal some personal situations or circumstances. So in today's briefing, we're going to cover 6 things. Firstly, the current COVID surge, what we know about it so far. Secondly, what are some good risk management and prevention strategies to keep transmission low and out of your workplace in the current environment. Pardon me. And thirdly, what to do if you're exposed to the virus. So whether that means you are positive or whether you are a close contact. Fourth, we'll talk about supporting someone who is COVID positive. So we do know that in the last month, a lot of members have been asked to support an NDIS participant who is COVID positive. And we've had a lot of questions about that. So we'll talk a bit about that as well. We'll also talk about how we're here to help you as your union, what we're doing in advocacy to government around better support for the NDIS and for workers in the NDIS. And also other things that we are providing just to members as a part of your membership right now to help you through this very difficult time. And then, of course, we will get to questions. So if you have burning questions that you want answered today, hopefully I'll cover them in what I say, but if not, we will take questions at the end. And so you can put them in the chat box or the Q&A box in down the bottom of the presentation. I want to also just make a bit of a disclaimer, particularly for those who might be watching this later, that this is a rapidly evolving situation. The advice changes, the rules change, the restrictions change. And so I guess I'm trying to be as accurate as I can as of today, the 12th of January. And if you are watching this in later days, there could very well be different circumstances or different supports that are available or restrictions that are in place. So just do keep that in mind if you're watching it at another time. Okay, so let's kick off, and I'm going to start by talking about the current Omicron surge. And we know that this is a very highly transmissible variant. Infection rates are increasing at rapid levels. We have done a survey over the weekend of members working in the community and disability sector. Some of you might have been a part of that. And what we found was that just in the last month alone, 10% of members have contracted COVID. Not over the whole pandemic, just in the last month. And in the disability sector, it's actually slightly higher. The situation, unfortunately, is expected to actually get worse before it gets better. The health department in New South Wales has done modelling, which shows that they expect it will peak towards the end of this month with around 4,700 people in hospital. Now, as of yesterday, we were sitting at 2,100. So we're not even halfway there yet to what the health authorities say will be the peak. And because of such high numbers of COVID in the community, approaches to testing, contact tracing, and isolating have changed. So testing, as we know, can now be by both PCR and rapid antigen tests, and they're both recognised now as the accurate tests that can be used to determine your status. And we'll talk a bit later around accessing RATs and issues around that for our sector and some assistance we can give you to help you try to get RATs for yourself and your family. Contact tracing is also different now. Previously, it would be New South Wales Health that would do all of that, but they don't have the resources with this amount of numbers. So we all now have our own obligation to contact trace if we are positive, and employers or NDIS providers have to do that as well. If there are outbreaks in a service, they've got a role in contact tracing too, and we'll talk a bit about that later too. Isolation periods have changed as well for both close contacts and confirmed cases, which are now commonly 7 days rather than 14. But there are, I should say, additional testing and precautionary measures after 7 days, particularly if you continue to have or develop symptoms or are around vulnerable people in high-risk settings. I want to acknowledge also, this is a really difficult time, obviously, for everyone. I know that people on this webinar, I can see from the chat, have COVID and are going through that themselves, or if you haven't had it yet, I'm sure everyone knows of a loved one, a family member, friend, someone you support who has. And I just want to say on behalf of everyone here at the Union office, we wish everyone a very speedy recovery and mild experience of COVID if you do have it. And we're thinking of you right now. We know that 90% of workers in the NDIS and members of our union are still leaving home every day. They're not working from home. They are going out to support people, vulnerable people in the community, and that does come with significant risks. And we know that 22% of members have worked additional hours in the last month, and 10% of members in the disability sector have cancelled their leave, returned from their leave to support continuity of service at this time. So what I want to talk about now is what are some steps we can take to minimise the transmission of Omicron in our workplaces, because I really think that when we are at work, we shouldn't just think that, oh, well, this is everywhere, everyone's going to get it, nothing we can do about it. That's really not true. There's a lot of evidence about a lot of things that still work to prevent transmission of COVID in high-risk settings, which disability services are, because we're in close contact with people, and those people are often very vulnerable and at risk of more severe COVID. So it's so important that we don't just throw out all the prevention measures and throw out safety because we think that, oh, well, it's just here now and everyone's going to get it. That's not the right approach. So I want to start with, what can we do in workplaces right now to minimize the spread as much as possible of this variant of COVID? I'll share my screen. Just hold on a second. Let's have a look at this. Okie doke. I hope you can see that. I can't see you, but that's okay. So I've gone through all of this. Okay, so preventing COVID at work. So the first thing, it is really important that you have updated your risk management and continuity of service plans, and that workers have been consulted on that and are aware of that. Now, you might be thinking, what's he talking about? Hopefully that's not what you're thinking, because throughout the whole pandemic, NDIS providers have been required by the NDIS Commission to have continuity of service plans that essentially talk about a plan for what we do if there's an outbreak or how we minimize outbreaks. And those plans are meant to be consulted on with workers, and you should know what they are. And the plans aren't meant to just be fixed, because as things change in the pandemic, the plan should be reviewed. So the first step is that it's really important that your provider has had a discussion with you about reviewing those plans, looking at them again, making sure everyone's aware of what measures need to be in place. And this is also an obligation under the Work Health and Safety Act. So employers are required to eliminate risks. Now, I know with with COVID, it might be hard to eliminate completely the risk of that, but if you can't eliminate, you have to reduce as much as is reasonably practical the risk of COVID in the workplace. So that needs to happen as a starting point. Everyone should know, what is the plan we have in place in this workplace to minimize spread? What are all the things we should be doing and the measures that should be in place? And what should we do if it does come into the workplace? Now, what should be in those plans though? What are the typical things that work? Well, we know what works, and we know in particular in the context of now, January 2022, what's really important. So number one, get your booster shot. Vaccinations, we know, are really effective at minimizing the risk of transmission, but particularly minimizing the risk of severe COVID, hospitalization, ICU, and death. Boosters are now considered really important. The evidence from overseas that has come in shows that they actually are really effective in responding to Omicron. And for that reason, ATAGI, which is the sort of the Health Australian Technical Advisory Group on Immunisation, health experts that advise our government have actually said that boosters need to be brought forward in their availability, and they should be available if you had your second dose 4 months ago, and that will reduce to 3 months by the end of January. And they've also said that workers in any high-risk setting should get their boosters ASAP. Now, another thing we know about boosters is that the New South Wales government has said it will make boosters compulsory for workers in the disability sector, but they haven't announced more detail on that. We don't know when that will happen, what the phase-in will be, but we know that vaccination is currently by a health order mandated in the disability sector. So it sounds like they will extend that to include your booster shot. So please get boosted. It does make a difference. We do know that. Our survey showed that 30% of our members in disability have got their booster. So that's great. But it's important that we all get boosted when we are eligible. Now, if you don't know how to get one, or you've struggled to get a booster, in the link now, Tom is going to put in the government booking service for a booster. And also the other link we'll put in there is the New South Wales government health vaccine clinics, because a lot of the New South Wales government run clinics, they actually provide walk-ins. So you don't need your a booking. So if you might have a booking for, if your GP might be, not have any bookings available this month and you really want a booster now, I would look at the New South Wales government hub closest to you that does walk-ins. That's how I got my booster. I just rocked up one morning. I said, I want to just get it today. And within an hour or two, I walked out with my booster, no booking. So I would recommend those as well if you can't find bookings from your GP or pharmacy. Okay, so risk management plan, get your booster. The other thing is work from home if you can. Now, states like Queensland have actually introduced orders saying you should work from home unless you reasonably, it's not reasonably practical to do so. And the ACT has recommended it. New South Wales hasn't issued that yet, but we know that that is an obvious way to stop the spread. Now, most disability support workers can't work from home. If you're providing direct care and support to someone, that isn't an option. But for people who worked from home throughout earlier stages of the pandemic, I think it would be really important to continue that now. In our survey, 6% of members told us they are going to work when they don't need to. Like they are going into the workplace, but they don't provide any direct support and they don't actually really need to be there. So that 6% staying at home could be effective at reducing transmission across workplaces. And it is a measure that people should be considering. Now, if your employer is currently requiring you to come to work when you were able to work from home previously in the pandemic, that's something we should have a union meeting about, and we should talk to your employer about that, because it really is something that they should be allowing staff to do if you can and if you have done it before. And I also think that a government-funded organisation that supports people with disability should have a bit of an ethical and moral obligation as well to do its bit to stop the spread as much as it can. And having staff come into an office when they don't need to be isn't what they should be doing. So what else can we do? Provide paid isolation leave and support for all workers. So it's critically important if you're a close contact, or indeed if you've had the virus, that you are able to isolate and you don't put others at risk. So, but you shouldn't have to lose pay to protect your safety and the safety of others. We know that 1 in 4 of our members who have had COVID in the last month had no leave, no sick leave, no government payments, nothing. And that's outrageous. We don't want members ignoring isolation requirements because they can't afford to comply with them, especially when a lot of the isolation is kind of self-regulated at the moment. So it's really important that workers are supported to do that. Now, a couple of things organisations can do. Firstly, if you can work from home during your isolation period, then you should be able to do that. And we know of disability agencies who have said, look, if you have to isolate as a close contact, you can, do online training modules or other work from home that will pay you for while you're isolating. Obviously, if you're sick and you have symptoms, you're unwell and you need to, don't work, you should be supported to recover. But if you're a close contact that doesn't have symptoms, you could do those kinds of things at home. Unfortunately, though, while we're campaigning for a universal isolation leave entitlement for all workers, we haven't won that yet. But you can sign the petition to help us win it. We'll put that in the chat. But we have worked to win this for over 20,000 workers in New South Wales and the ACT in our sector. There's a list of agencies that have agreed to provide this to their workers, thanks to the great work of ASU members, and that list's on our website, and we'll put that list in the chat. So if your organisation's on that list, they may provide you with that additional leave. Okay, so the other thing that we can do to prevent COVID at work and coming into the workplace is having appropriate PPE. Now, this is a really big issue right now in disability services, and something that our survey showed, which was pretty concerning, that people are required to attend work in high-risk settings, not having the appropriate PPE. The advice has changed a bit around PPE and Omicron because it's so transmissible that really what the health department is saying is that to minimise risk, you need a P5 or N95 mask, not just a surgical mask, but a N95 or P5 mask. And your eyes should be protected from an eye shield or face shield. And this can actually make the difference between whether you are considered a close contact or a casual contact, and the level of risk that is associated with the exposure for you in the workplace. So I'm going to show you something that the health department sent to every NDIS provider on New Year's Eve. And I'll just put that up now. Where is it? Here it is. So they said this. I hope you can read it. I'll talk you through it. We can send it to everyone in the link. And as you can see, this says this is a risk matrix that the New South Wales Health provided to disability services to help them assess what the risk is for people if COVID comes into a disability service. So you can see here, this is assuming that the staff member, all the workers, are fully vaccinated, which I think means 2 doses here. So if you've had your 2 doses and you're fully vaccinated, then you can see down the side, depending on what PPE you are wearing, the level of risk to you at contracting COVID from someone else in your workplace really varies. So you can see if you're just wearing a surgical mask, there might be a low risk if you're just a transient contact, sort of, walking around an office a bit for less than 30 minutes, interacting with someone. But if you're supporting someone and you can't socially distance and it's for greater than 15 minutes, which is going to be most settings in disability services, your risk is actually really high still with a surgical mask. But if you have a P2N95 mask and eye protection, which is down the bottom, regardless of the PPE the COVID positive person's wearing, your risk is deemed low. And what does that mean? What's low risk? Well, they show this, as you can see here on this screen. A low risk classification means that you don't need to isolate, you just monitor for symptoms and can continue to work. But if you didn't have all of that PPE and COVID came into the workplace, either through another worker or through a participant, then you could be deemed high risk, and high risk would mean you have to go and isolate straight away and follow the isolation protocols. So this is from the New South Wales Clinical Excellence Commission, which is a part of New South Wales Health. It was designed to support disability services, make assessments around who is and who isn't a close contact. And as you can see, PPE makes a huge difference. Vaccination plus the appropriate PPE, not just a surgical mask, but P2N95 and eye protection. So if we have that in workplaces, that will really help stop the transmission. It will also stop people having to become close contacts and isolate, which will help with if there are staffing issues as well. So that's a really, really important resource, which I think Tom has put in the chat as well. We can send you that link so you can download that advice from the health department, look at it yourself and discuss it with your colleagues. We actually know that only 40% of members who are going to work in high-risk settings have been given eye protection. That's according to our survey on the weekend. That's concerning. That means that if there is transmission, they're more likely to be in high risk, which means that people are more likely to either get the virus or have to isolate as close contacts. Whereas with that full PPE, that won't necessarily be the case. So back here, finishing my list, what can we do to prevent? Also access to rapid antigen tests. Now, we know that access to free and quick tests is a really important way and a very important safety measure to prevent COVID in workplaces, especially where people can't work from home and are providing essential services to vulnerable people. We know that 30% of members are currently required to use rapid antigen tests at work, but of that, nearly half of them have to source them themselves. They're not given to you by your provider, which is outrageous. We know these are so important. We're calling for them to be free, universal. We know that People with Disability Australia and advocacy groups are calling for the same thing, and pretty much everyone in the disability sector is doing that. The New South Wales government has said that they've purchased 100 million, and they're on their way, but we don't know when they're arriving, when they're going to get to disability services, and how we're going to access them for our members. So we just don't know that yet, but we know they are so important. And it's really frustrating when you see stories in the news today that politicians are all being handed free packs of 20 rats each to protect themselves, and frontline essential disability workers are struggling to get it to protect them and the vulnerable people they're supporting. So we have a petition for free rapid antigen tests. Do sign it. It is in the chat box. The other thing I did just want to let people know about, in the absence of government support for this, a lot of people have been, trying to find them where they can for their service. I wanted to let you know about a community-based website that exists called findarat.com.au. You may or may not have heard about it. It's based on community members logging on this website where they find rats available, so other people can know about it. And it's updated in real time. It's only reliant on the information people put in it, but it might be a way for you to check to see what is available in your area. So that chat has been put in the chat box. The other thing about rapid antigen tests that I should just say is important is it's been announced today that it's now compulsory to declare a positive rapid antigen test, and if you don't, you can be fined $1,000. Service New South Wales app now has the capacity for you to do that on that app, and we also know the NDIS Commission actually has required for a few weeks now providers to report to them as well any positive cases, including rapid antigen tests in disability services from workers or participants. So when you get a positive RAT, if it's identified from a worker or a participant, it does need to be reported. So it can be included in and we know about the spread, but also people can be targeted with the support that they need, particularly if they are vulnerable. Okay, and what else? Well, everything else we know that has worked to prevent COVID, we should continue to do. That's social distancing, proper ventilation, minimize contacts and sites if we can. So, if you were working across 4 sites and now talking about, swapping shifts to work across less sites and things like that, and we've done that before, those kinds of things probably need to be considered in consultation with workers, obviously, and shouldn't be any disadvantage to you financially or in terms of your hours, but adjusting where people are located is another one. Looking at online or remote service delivery, and potentially changing the nature of some activities that happen to minimize contact. So that's a big sort of suite of things that we know work, that we know are important, that can prevent transmission, including Omicron, in workplaces in the disability sector. So the next part I'm going to talk about is what happens if you are exposed to the virus. So firstly, if you are exposed to the virus, your employer is obliged to work with you to work out your level of risk and do the contact tracing, which you need to do. And that risk matrix that I shared before can help in doing that. And if you're exposed at work, there are obligations for employers to report things to the NDIS Commission and also Safe Work New South Wales. So if you are COVID positive, what are some supports available for you, and what are your rights? So if you do have COVID, obviously you need to isolate and recover from the virus. And I really hope that's a very, very mild case or asymptomatic even for you if that is the case. If you are in a high risk category though, you need to contact the New South Wales Health COVID Care Hotline. You and your household have to isolate for 7 days, even if you're all fully vaccinated. You do need to tell your social contacts you've tested positive and your employer, as I've said, and you can't leave the self-isolation until after 7 days if you still have symptoms, I mean to say. So if you don't have symptoms, you can, but if you still have symptoms, you need to stay isolating until those symptoms stop. So as an employee, a worker in the disability sector, there are a few supports that are available to people who are COVID positive. The first one is, does your organisation have special isolation leave or COVID leave for people who are COVID positive. Lots of organisations have done that, and that's a really great thing. So I'd want to check first, is there special extra leave that you can access? I know some agencies have worked with the union to provide that for casuals too, and casuals don't normally have leave, but many organisations have committed to paying casuals if they get sick with COVID too. So the first thing is, what does your employer provide that might be different to the award or on top of the award? Secondly, if they don't have anything like that, then obviously if you're unwell, if you have COVID, sick leave, part of personal leave, is available for you, and you can follow the correct, the policy or process to access sick leave at your organisation. If you are a permanent employee, you are entitled to sick leave, whether you're full-time or part-time, under the award and the Fair Work Act. So, and also if you have an enterprise agreement, you might have additional sick leave too that you can access. If you don't have any sick leave because you have exhausted it, or you don't have access to it because you're a casual, you could access the pandemic leave disaster payments that exist from the Commonwealth Government. They have been updated where you can, a rapid antigen test can be enough to access. You can get $750 as a one-off payment, and we'll put the link in the chat to access that. You just can't have any sick leave to access it. So if you have sick leave, you need to use that. If you don't, you can access that payment. New South Wales Health have also put out fact sheets to support people with COVID, which we can put in the chat if that's you, to want to have a read of them or understand what those are. And they're really good resources to talk about supporting yourself at home and what you need to do, and resources for additional assistance. So what about if you don't have COVID, but you're a close contact of someone who is COVID positive and you need to isolate for 7 days? So if you're a close contact, the current rules are that you need to isolate for 7 days. You need to take a rapid antigen test as soon as possible, if you can get one, and again on day 6, and again if there are any symptoms. And if all of those tests are negative, you can leave your isolation at day 7. And again, there are fact sheets for people who are having to isolate as close contacts, which we can put in the chat box. Now, in terms of financial support, it's a bit similar to if you had COVID. Many organisations have worked with the ASU to provide paid isolation leave for people who have to isolate, particularly if you have to isolate because of you being exposed at work. And as I said, 20,000 workers in New South Wales have access to that, thanks to ASU members advocating for it. Not everyone, but a lot do. And the list is on our website of the organisations that provide that. The other thing, if you're isolating, as I said earlier, if you can work from home, then you don't actually need to take leave at all. You just work from home while you're isolating. So that's an obvious option for a lot of people. And we know of agencies that are facilitating that too, so you don't have to use leave for your isolation period. If there is no additional leave or you can't work from home, then you could look at other paid leave entitlements, such as your annual leave or part annual leave or long service leave. There is also unpaid pandemic leave under the award. And again, you could try to access the pandemic disaster leave payment. Unions are advocating to make that easier for close contacts to access. And hopefully the government will listen, but you can certainly try to apply for that $750 payment as well. It does apply to people who are also isolating as close contacts. And lastly, if you are caring for someone with COVID, you might very well have to isolate with them and be a close contact. And again, similar leave arrangements apply to you if you have a special pandemic leave, but also carers leave, paid carers leave you could use in that situation, which comes out of the same bucket as sick leave. It's all sort of called personal leave these days, and you can use it for sickness or for caring. So there is paid carers leave if you are a permanent worker. If not, you don't have that or you've exhausted that, again, that $750 pandemic leave payment can be used, can be accessed for people caring for someone who's isolating. So you can try that one too. Okay, next section. Supporting someone who is COVID positive. So we recognise that there are a lot of cases in the community, but that doesn't mean that your rights and expectation to a safe workplace should be thrown out the window, and it certainly doesn't mean that people with disability should just not expect anymore to have safe service provision for them either. We do know that 13% of members in the disability sector have supported someone who is COVID positive in the last sort of 4 to 6 weeks. This is becoming something that is much more common and wasn't as common previously. So what happens, or what should be happening if you are asked to support someone who is COVID positive, or if you're thinking about being prepared for this situation, which everyone should be if it does happen? So let's start with some fundamentals. Employers have a duty to provide a safe workplace, to eliminate risk or reduce it as much as reasonably practical. I spoke about that before in terms of preventing it coming to a workplace. And they are meant to consult with you on their safety measures, and are required by the NDIS Commission to have pandemic response plans that you need to know about. And this shouldn't be new. This should not be something that an organisation is just thinking today, oh, what will we do if someone gets COVID? Hopefully, these plans have been in place. You know of them, you've been trained in them, because that's the starting point. The first step needs to be, what has your employer done to develop continuity of service plans and proper risk assessments to support someone with COVID that you are aware of, have been consulted on and trained in. So that is step one. And then the second step is, well, what are the kinds of safety measures that really need to be in those plans if they aren't already, particularly in light of the current outbreak? So a few things that I would always put on a bit of a checklist around getting ready to support someone who might be positive, to do it in a safe as possible way, would be, firstly, that the workers that are supporting that person need to be properly trained in what the COVID care protocols are for that particular participant, because it's not going to be the same for everyone, and you need to know how to provide supports to that person as safely as possible when they are COVID positive, and what things to look out for that they might need. That would include things like emergency plans, when that person might need urgent medical care, and what you're going to do, how you do that, who you contact, how you get that person to the hospital or wherever it might be. That should be all things you know before you step into the workplace to support someone. The second thing is there should really be additional supervision for you and access to 24/7 supervision. And that supervisor needs to be a bit of an expert in how to do this, not someone that has no idea what's going on. They need to be really on top of this issue, someone that you trust, someone that is really an expert in this, that you can call at any point if you need advice while supporting someone. Appropriate PPE goes without saying. You definitely need to have the full PPE, including P5, N95 and eye protection, face shields. If you don't have that, you are putting yourself at risk, and it's unacceptable that an employer would expect you to do that. The PPE really needs to be available if you're supporting someone who is COVID positive. And you need to know how to use that PPE properly too, by the way. So hopefully you have been trained in how to use it if you've not used it before. Obviously, vaccinations and boosters would be good. I would want to ensure that people supporting those who are COVID positive have had their booster ideally, and certainly otherwise they have to be vaccinated anyway. Rapid antigen tests should be available to support people to stay safe and to check for if they have any symptoms, so that they're aware if they then do get it, and because that could impact their family and loved ones as well. So they really need to be available for regular screening. People need to be paid properly. So we're getting a lot of stories about people being asked to take on long shifts, extra shifts, overtime. Well, people need to be paid for that overtime according to the award. The award's very clear on how to work out overtime and pay for overtime. That needs to just happen. The award doesn't fly out the window just because someone has COVID. And further, some organisations have gone beyond the award and actually provide a COVID care allowance, which is something the union advocated for from the beginning of the pandemic, which is an additional payment for people supporting someone with COVID in recognition of the skill that it takes, the additional skill and diligence to support someone sensitively, appropriately in a COVID environment. So many organisations do actually provide that. The other thing that I think would be expected is that there is additional leave. So if you are supporting someone with COVID and then you actually have to isolate or you get it, that should just be additional leave that is covered for you. It shouldn't come out of your personal leave bucket, or you shouldn't have to take your annual leave when you are knowingly in a situation where that is a higher likelihood. Then all of that support should be given to you without going into your own entitlements. I think a position we've had all along is that these situations should start with volunteers. People really shouldn't be compelled to do this because lots of people might have their own vulnerabilities as well. So organisations, I know a lot have already done this and have sort of people that they've called to volunteer and that are willing to do that. So I think that's an important starting point. And the other one I say is, again, considering your own vulnerabilities is important too. And people who are themselves immune compromised, pregnant, in other high-risk categories, they should not be rostered to do that work. Now, if your employer says to you, oh, we'd love to do that, but it's just too expensive, we couldn't do that. I'd have a couple of things to say. Firstly, cost is not a justification under the Safety Act for not taking appropriate measures. It isn't. It explicitly says it isn't actually. So that's the first thing. And secondly, the NDIS actually does provide quite a bit of money to support providers who are supporting someone that's COVID positive. In supported independent living, a provider will get $1,500 additional funding per day per participant that's got COVID. So that's quite a bit of additional resources that can be there to support this list of things to make sure that work is done as safely as possible. And I just want to say at the end, you have the right to refuse work that is unsafe, and that is a right under the Work Health and Safety Act. And an employer can never force you to work in a situation that is unsafe. So if you feel that you are being forced to work in an unsafe situation, if you're being asked to do something that you haven't been consulted on, trained in, provided with these considerations, including your own personal ones, contact us, contact your union, and we'll talk to you about what we can do to help in your situation. We have a professional standards and safety unit that can help you. So please call us. Don't feel forced or pressured to be in an unsafe situation. Okay, we're nearly finished up to the questions, and I've been talking quite a lot, and hopefully some of your questions I've managed to answer along the way, but we'll get to them very shortly if I haven't. I just want to emphasize that as your union, what we're doing to advocate for better support for you at the moment. We've written to the federal government and the state government. We've said that there should be free rapid antigen tests available for all workers in the disability sector and participants. We've got a petition, please sign it, share it. We're asking for every worker to have access to the appropriate PPE. It's really concerning that 30 to 40% of disability workers don't seem to have access to eye shields when that's such an important part of the PPE right now. So that's what we've called for. Obviously, we've been campaigning for universal paid isolation leave for a long time now. 20,000 workers have it in our sector, but that's not enough. It should be 100%. So again, sign the petition, get on board the campaign, and we've been calling for that again. And we've also been calling for proper safety and risk assessment approaches at all times. We don't accept this idea that, well, everyone should just get it or is just going to get it. We don't need to care about safety anymore. We will never accept that safety is thrown out the window. These are rights that generations before us have fought for and won as union members, and it's really important that we always stand up for safe workplaces and safe services for people with disability. Okay, also I'd like to remind you about some of the other supports that we have available to assist just members. So we have our member assistance line. You can call in business hours, and we've got a team of people here that can give you support straight away with any of your COVID questions or other questions you have. You can also email us at help@asu.org.au. If you are isolating or you are unwell or you're in just financial difficulties at the moment, we've got a lot of discounts you can access. You can get all of your Woolies and Coles deliveries with a I think it's 5, maybe it's 4, with a discount as a union member. And we also have free short courses, information sessions, professional development just for members through our college that we have. And so all of that is also there available for you. And we have just launched a jobs advisory service. So if you're thinking, I want to look for another job at the moment, we have a jobs advisor who will be starting, I think, next week, and you'll be able to book in to speak to her and get some jobs advice around your CV, interviews, job applications, and things like that. So you can call us to make a booking to see her. Okie doke. Let's go to, I should have shown all these to you before. Your questions answered. Okay, I'm going to go through to the frequently asked questions first that have come in before today, because we've had, as of yesterday, we've had 280 inquiries this week around COVID. So we've summarized the most popular ones, which I'll go through first, and then I'll get to your questions in the chat. So there's quite a few around how do I tell if I've been exposed? Am I a close contact? Am I casual contact? How long do I need to isolate for? I would recommend using that matrix that I sent around in the chat from Health that really helps you if you're exposed at work to assess the difference between a casual contact and your risk profile. If you are a close contact, how long do you need to isolate for? Well, it's 7 days, but it does say if you're in a high risk setting, you actually should still stay away for 2 weeks unless there's been a risk assessment done on your return. So that's why it's important you are telling your employer if you're positive, because when you return to work, or if you're a close contact, there still needs to be kind of a bit of a risk assessment. So then, what does that mean, or how do we need to change in the way that you're working or what you're doing? I'm COVID positive when I can return to work. Again, I sort of went over that one around. You do need to isolate for at least 7 days. Once you've got the negative RAT test on once your symptoms are finished at day 7, you can leave isolation, but that's only if you have no symptoms. And it's important that you still wear a mask and socially distance for a few days is what's recommended by New South Wales Health. And if you are going to go to work after the 7 days, again, it does say you need to talk to your employer about a risk assessment for your workplace. Another common question was, I'm worried, this is a very common one. I'm worried about getting COVID. I want to work home for the rest of summer. I don't want to come into the office. What are my rights? So with this one, we talked a bit about it at the beginning. Whether working from home is reasonably practicable at your workplace will depend on, what you do, the facilities available for you to work from home, and the ability for you to do your work effectively and safely at home. So if work can be completed at home, and the risks that might arise from working from home or remotely can be effectively managed, then I think working from home is a really good way to minimise the risk of exposure right now. And in assessing whether you should be working from home, I think employers also have to take into account any vulnerabilities you have. So things like your age, any immunocompromised conditions you have, if you're pregnant, if you're over 50 and Aboriginal and Torres Strait Islander. So the starting point, I think, here is basically having a discussion collectively and with your employer. If you were ordinarily working from home during the pandemic, I really don't see why you shouldn't be able to do that now. Obviously, it's hard and probably not possible. It's not reasonably practicable if you're a direct care worker, but everyone else, it should be a discussion. And there's also other avenues around flexible work arrangements and rights to request those under the Fair Work Act. So I think if you're in that situation, you should contact us. Let's see if there are other people that are in the same situation at work. Let's have a union meeting. Let's talk to your employer and hopefully have a sensible approach to that, which does minimise the amount of people that need to come into the office at all. The other one that is very, very common now is, can I be forced to work with someone who is COVID positive? So I guess the starting point for this is that employers can only ask you to do things that are sort of lawful and reasonable directions, is what it's called under the law. So, and what's lawful? Well, the safety law says that there must be measures in place to mitigate risk against you in all settings. And we've discussed what some of those things would be, which would be training, access supervision, PPE, rapid antigen test, knowing emergency planning, what to do if you develop symptoms, access to additional leave, payment for all-time worked, considering the risk factors you might have as well, pregnancy, immunocompromised, vaccination status. So I think that those are all the considerations that would assess whether it's, that would have to be considered and approved by an employer to sort of make it a reasonable request. But at the same time, you also have a right to refuse to work in an unsafe environment. And I'm really worried about people being pressured to work in environments that don't provide those things, that don't have training or support, that don't have full PPE, that don't have risk assessment plans, that don't have emergency plans, that don't take into account individual circumstances and vulnerabilities. And if you are worried about being pressured to work in such an environment, call your union. That's what we're here to do and here to help you with. And I also would say that I think in these instances, employers should always call for volunteers first anyway, as well. And that's what we've said throughout the whole of the pandemic, that would then minimise anyone being required or forced to do it anyway. But even for those volunteers, they should have all of those measures as well. So that's really important. Next question, can I be forced to return to work while I am COVID positive or while I am isolating as a close contact? No, you cannot be. I know this has happened and I'm hearing this happening, but you need to know that actually you're putting yourself at risk of breaching a public health order, and certainly your employer is as well. Public health orders are in place. If you are positive, you need to recover. You need to not put other people at risk. If you are isolating, you are not able to leave your home for 7 days, and that's actually by law. That's a public health order, and you can only actually go to work after 7 days in a high risk setting if appropriate risk controls have been put in place. So if you are being asked or pressured to return to work when you're COVID positive or in an isolation period, you are potentially putting yourself or others at risk and vulnerable people you support at risk. And you could inadvertently or be also breaching public health orders, which attract significant fines, and certainly your employer would be. So if that happens to you, if you're put in that situation, call us immediately, because that's not acceptable and it's against the law. So other questions that we've had, we've got 5 minutes left. Some member said that they got COVID from work and they don't feel supported, and says, surely we don't have to use our own leave in this situation. I agree that you shouldn't have to. And that's why we're campaigning and fighting for universal isolation leave to cover you if you have to isolate because you've got COVID or a close contact, which means you wouldn't have to use your own leave entitlements. But we haven't won that as a universal entitlement. It's outrageous the government hasn't supported it. So the current position, as I sort of described before, is if your employer doesn't provide that, you can use your personal sick leave. If you have no sick leave, there's the government disaster payments. Okay, Kim asked, what's the pandemic leave that's been extended to June 2022? That's the unpaid pandemic leave, Kim. So that's in our award, and it just says that if you, it's not the one that unions, we want it to be paid, but there is unpaid pandemic leave if that exists in the award, and that has been extended till June. Another question, if boosters will be compulsory, why is our employer not offering a clinic for staff? Good question. I think that as it becomes clearer when and how boosters are compulsory, as I said, they haven't made that order yet. It's coming. They've just said in the media this is going to happen. We hope that there will be access for members, particularly in disability sector, to get it as soon as possible. But I did put links in where you can find bookings. And if you're keen to get it sooner rather than later, I personally would just recommend the walk-in New South Wales Health Hubs, because you don't need a booking and you can just rock up and they'll vaccinate you. Okay. We've got some questions from, I believe, like a manager and employer about always wanting staff to have the option of supporting a confirmed case, but people are sort of not, there aren't many people are putting their hand up to do that, and what can we do in terms of continuous support. So I think that in those situations, you need to look at the suite of supports we've talked about today and see, is that what you're providing to your staff, and have a discussion about all of those supports being provided. I think that might potentially get you more volunteers. And if that doesn't work, or people still are concerned, I guess the obligation for you is to talk to the NDIS Commission about options available to your service for the continuity of service. Some other questions. Can we force to be support COVID positive? No, I've already covered that one. I'm working from home and have been told to take 2 hours of leave because I'm not as busy as I would be. Can you be forced to take annual leave? Well, no, contact us about that. We'll help you with that. That doesn't sound very reasonable. You can't be unilaterally forced onto annual leave for 2 hours a day for things like that. That sounds very strange. Do contact us. Got a second lot of questions here. Just reading it now. If we work in drop-in, should the company have guidelines or restrictions encouraging work from home? Shouldn't we be encouraging clients or staff not to be going out to busy, crowded areas? I emailed my coordinator last week and was told that community access is going on, essentially. Yeah. So there aren't orders saying that you can't. There was in the previous waves and lockdowns, things like day programs closed, community access closed. Those don't exist now. I think it's about that risk assessment discussion. And it's also what the participants want to do. Like, they obviously have the right to lead their lives as you and I are leading our lives right now. So it's something I think that is a risk discussion that needs to happen in consultation with your participant, with the workers, around what people feel comfortable and safe doing. I know anecdotally a lot of participants are no longer attending, wanting to, by choice, group-based activities. But I think it really is about discussion, and that's why we know risk assessments and continuity of service plans are meant to be discussed with workers as they are reviewed and as the circumstances change. So that's really important. Another question, how much of a COVID care allowance are organisations paying to workers? It's about an extra $5 an hour on average, and it's or an equivalent of being bumped up a classification. So if workers were level 3, paying them level 4 or something like that. That's the sort of the average, is what I know about it. Deborah, how long after I've had COVID can I have my booster? Oh, Now, this one, check with your GP. I don't want to give the wrong health advice to someone. It's probably a health advice question. I'm not exactly sure. I know in other countries they have rules about it. I don't think they have that here in Australia. So I think the best thing, talk to your GP about that one. Another question, if you're working from home, should there be a risk assessment still taking place? Well, there should be risks about, there should be consideration that you can work from home safely. And we do know that, for example, members who might experience, for some members, home is not a safe environment. They might experience family violence, and actually going to the office is safer for them. So there does need to be a consideration of the home environment being safe, yes. Can you be forced to work in an office where others are not vaccinated? Well, I guess this comes down to what the vaccination policy is of the organisation and the relevant mandates and what discussions and safety protocols are going to be put in place, because if someone isn't vaccinated, they are putting other people at more risk. Now, they might, though, have a medical valid contraindication exemption, but that still means, though, you need to consider the risk on other people. That might just mean they can continue to work, but it could impact others. So those things need to be discussed collectively in the workplace with your organisation, and we can help facilitate that. Okay, it's 12:01. I might finish there because we have gone for an hour and I know some people will need to leave and go back to other things. I want to thank everyone for coming along today. I hope that most of your questions I've been able to answer. If I haven't, call us. We're here to help. We've got a whole team here that can help you with any advice or support you need. Thanks again for joining us today. Please never forget that we are here. We are by your side. We're fighting and campaigning to make things better for you right now, but also have a lot of support we can give you while we advocate for change. So thanks very much, everyone. Stay safe as you can, and see you all soon. Thanks very much.